Hello.
My name's Kate. I'm an RN, and I'll be assessing your thorax and lungs today, okay?
Okay.
Alright, well, I've washed and sanitized my hands, and I have my gloves on, but I want to verify your name and date of birth, okay?
Okay.
And I've got that your name is John Doe, date of birth 4/26/1990. Is that correct?
That's correct.
Okay. Before we begin, I just want to ask you a couple of questions that pertain to the assessment today, okay?
Okay.
Do you currently or have you ever had any history of asthma or any chronic lung or respiratory illness?
I had asthma when I was younger.
Okay, and so you no longer use an inhaler?
No.
Okay, how old were you when you stopped using an inhaler?
12.
Okay, and do you smoke cigarettes, cigars, anything like that?
No.
Okay. All right, well, just looking at you, you are sitting upright at a 45-degree angle. You have a relaxed facial expression. You're conscious, alert, and oriented. Your skin appears pink. Your lips appear pink. I don't note any cyanosis. Your respiratory rate's about 14 breaths per minute. They're even and non-labored. You have bilateral chest rise and fall with a regular rhythm and depth. I don't note any nasal flaring as you're breathing, no pursed lip breathing, or no use of accessory muscles, okay?
Okay.
All right, I want to look at your nails really quick.
Okay.
All right, your nail beds are pink. I don't see any clubbing. The angle from the base of your nail to the bed of your nail is approximately 160 degrees, so
Okay.
that's normal. If you would just lift up your arms for me.
Okay.
All right. And your AP to transverse diameter appears to be approximately 1 to 2, so that's normal. You can put your arms down. Your sternum is midline and straight. Your trachea is midline and straight. There's no deviation of either of those. I don't note any sternal retractions. Your ribs appear to slope downward in a symmetrical manner with with symmetrical intercostal spaces. There's no retraction or bulging of the intercostal spaces. I just want to palpate your chest really quickly, okay?
Okay.
Alright, and as I'm palpating, do you have any tenderness or pain?
No.
Okay, and I don't palpate any lesions, lumps, masses, no protrusions. Next, I want to check for fremitus. So what I want you to do is I'm going to put the side of my hand on your chest in different places. And when you feel my hand touch your chest, I want you to say 99, okay?
Okay.
Let me get on this side. Okay?
99. 99. 99. 99. 99. 99.
Good. And so as you're saying 99, I do feel the vibrations bilaterally, so that's normal, okay? Next, I want to percuss your anterior thorax, okay?
Okay.
So I'm just going to lightly tap, okay?
Okay.
All right. Okay, and as I'm percussing, I do note that you have flatness over the clavicular area. I percuss resonance in the intercostal spaces and tympany in your stomach area, okay?
Okay.
All right. Next, I want to auscultate your chest or just listen to it. All right. Whenever you feel the stethoscope touch your skin, I just want you to take a deep breath in and out, okay?
Okay.
And then as I touch it again, you take another one. One more. Good. So as I'm auscultating, I do note that you have bronchial breath sounds over your trachea area. Bronchiovascular breath sounds over your first and second intercostal spaces, and vesicular breath sounds over your bilateral peripheral lung fields. And there's no adventitious breath sounds that I'm auscultating, so that's normal, okay?
Okay.
Alright, next I want you to turn around in the chair for me.
Okay.
And I'm going to have a look at your posterior thorax.
Okay.
Alright, so just looking at your posterior thorax, your scapulae is symmetrical with no protrusions. Your shoulders and scapulae are in a horizontal position. Your thorax appears symmetrical. Your ribs slope down at a 45-degree angle. I'm just going to palpate your posterior thorax, okay?
Okay.
Any pain or tenderness as I'm doing this?
No, ma'am.
Okay. And as I'm palpating, I do not feel any lesions, lumps, no masses, and I do not feel any crepitus, okay?
Okay.
All right. Next, I want to check for firmness on your posterior thorax. So, same thing as we did on the front. Every time you feel the side of my hand touch your back, I want you to say 99, okay?
Okay. 99. 99. 99. 99. 99. 99.
Good. So, as you're saying 99, I do feel or palpate the vibrations symmetrically bilateral. Okay?
Okay.
Alright, next I want to check for chest expansion. So I'm going to just put my hands about at your T9, T10 level and kind of push together your spine. And I want you to take a deep breath and let it out. Alright, and as you do that, my hands move out equally, about 6 centimeters apart symmetrically. So you have a normal diaphragmatic excursion, okay?
Okay.
Oh, I'm sorry, not diaphragmatic excursion. You have the normal chest expansion. Okay, so next I just want to percuss your posterior thorax. So same thing, I'm just going to lightly tap, okay?
Okay.
You don't have to take a deep breath or anything, just sit still. I'm starting below the scapula. And as I'm percussing, I do note that you have resonance over your intercostal spaces, which is normal, okay?
Okay.
Alright, next I want to check your diaphragmatic excursion. So to do this, I have a tape measure that measures in centimeters and a marker. So, what I'm going to do is I'm going to percuss. I want you to take a deep breath in just a second when I tell you to, and hold it. And as you're holding your breath, I'm going to percuss down until I no longer hear resonance and the sound is dull. And I'm going to do this on both sides as you hold your breath, okay?
Okay.
Alright, so take a deep breath and let it out. I'm sorry, take a deep breath and hold it. Alright, there you go. Alright, let it out. Alright, so now I'm going to percuss back up until I hear resonance again on both sides, and I'm going to mark where I hear resonance.
Okay.
So what I want you to do this time is take a deep breath and let it out.
Now?
And let it out. Hold it out. Good. Alright, you can breathe normal. Alright. So now I'm going to measure the space between the two marks on both sides, and I want those to match up. I want it to be symmetrical. So I've got 4 centimeters on the left side and 4 centimeters on the right side. So you do have a normal diaphragmatic excursion, okay?
Okay.
Alright. Next, I want to auscultate your posterior thorax, okay?
Okay.
So, as you feel the stethoscope touch your back, like we did on the front, take a deep breath and let it out, okay?
Okay.
Okay? auscultating, I do note that you have vesicular breath sounds bilaterally, which is normal, but I do want to also listen to the lateral aspects of your lungs, so if you will, just lift up your arms for me for just a second. Again, take a deep breath. Good, and you can put your arms down. And I do note that you have vesicular breath sounds on the lateral aspects as well, and no adventitious breath sounds on the posterior thorax, so that's normal, okay?
Okay.
Alright, next, I want to check for transmitted voice sounds.
Okay.
First way we're going to do this is to check for bronchophony. So I'm going to put the stethoscope on your back. When you feel the stethoscope, I want you to say 99, okay?
Okay. 99, 99, 99, 99, 99, 99.
Alright, so as I'm listening while you're saying 99, your voice is muffled and it's indistinct, which is normal, okay?
Okay.
Alright, next we're going to check for the egophony. So every time you feel the stethoscope touch your back, I want you to say E, okay? The
Okay.
letter E.
Okay. E, 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 E.
Okay. Alright, good. So as you're saying the letter E, it does distinguishably sound like the letter E. It doesn't sound like A, so that's normal.
Okay.
Alright, lastly, we're going to check for pectoriquy, the whisper pectoriquy. So how we're going to do this is I'm going to place the stethoscope on your back. Every time you feel me place the stethoscope, I want you to whisper really softly, 1, 2, 3, okay?
Okay.
Good. So I can't hear anything when you're saying 1, 2, 3. So it's indistinguishable. I can't hear you say 1, 2, 3 at all. So that's normal. All right. So that concludes my assessment of your thorax and lungs. Do you have any questions?
No, ma'am.
All right. Thank you.
Thank you.